Richard Ratcliffe, I want to start with you because Iran appears to be in the grip of one of the worst, outside of China, places in terms of coronavirus. Your wife is very sadly still imprisoned there, and the prison itself has been engulfed by this. What do you know about what is happening there?
That's exactly right, Piers. We've just seen, on last week there was no issue that anyone knew, and then it's just swept through the prison, through the whole country, almost overnight. We've had various prisoners showing all the symptoms of coronavirus, so coughing, temperature, body pain all over, fatigue. Nazanin, at the beginning of in the middle of the week, was complaining all those symptoms. The prison ran out of all cleaning materials, disinfectants. It ran out of medicines in the because, of course, the whole country was running out because it just was blindsided.
Iran has been completely swamped by this.
And every day the figures are going up, and then everyone's panicking and they're not trusting the official figures. They're not trusting, and of course you've got a certain bravado from certain parts of the regime insisting on continuing as normal.
But Nazanin's not been tested yet.
And the prison is refusing. They're obviously under orders not to test anyone.
And what is her current condition?
So I last spoke to her on Saturday, and desperate, trying to get tested, and we were asking the British government to press for her to be tested to get checked, because of course other prisoners were keeping away from her because she's showing all the symptoms.
And it's another. For you, you've been through so much with this. This must be just another agony heaped on agony. Yeah,
look, at this point, there's bigger issues, but I just want her to be tested and just to get checked. Let's get her, and then let's get some treatment.
But also the significance of what is happening in Iran, I think, is really important. Let's bring in Dr. McKeown, the Chief Officer of the British Medical Council and a GP in Wiltshire. Iran shows what can happen when you don't tackle this head-on quickly and efficiently. It appears to be almost out of control there. Are we doing enough in this country, do you think, to protect ourselves?
I think behind the scenes there's been an awful lot of work done. Someone like myself has been working with successive governments since 2007 for any sort of pandemic. So I think having a Cobra meeting today, arguably it would have been nice to have had it last week, but the planning behind the scenes has certainly been done to the highest levels. We are not Iran. We have an efficient NHS, albeit one that is absolutely running at 99%.
Are we dealing with a pandemic? And what is a pandemic compared to an epidemic?
So it's not for the British Medical Association to decide whether or not this is a pandemic. That's a decision for the World Health Organization, and we will follow that decision.
But what is your understanding at the moment?
My understanding is that we have a significant number of cases in this country now, with something like 36 cases, and that we can expect that there will be more cases today, tomorrow and during the week.
Dr. Barrett,
we're prepared.
Dr. Barrett-Pankania, you are an expert with years of experience in communicable disease control, infectious disease management. What everyone worries about is how bad is this going to get in the UK?
We don't know. And because this is a new virus, and when a new virus starts circulating, there's a lot that we need to learn about it and then map out what it's going to do, how it's going to behave. We have seen what it's done in China, in that most people who got infected have also got better. We also hear about, people have become ill and died, but that's a very, very small percentage. And the health message, the public health message is, yes, we have a new virus circulating, but this new virus is not going to harm a lot of people. Most people will get better.
But it is more aggressive than SARS and MERS, right?
No, not at all, not at all.
It's very different, actually. The death rate is far, far lower than SARS and MERS, isn't it?
It is. It's a little bit higher than influenza at this point in time, because we don't know a lot of the data. Definitely a lot lower than SARS, definitely a lot lower than MERS. And by the way, the SARS virus, due to public health actions, does not exist on planet Earth
How many
anymore.
died from SARS?
I can't remember. It was a small number.
But it was a 20. I think there was a 20%.
Yeah. It was only 700, right? We've already had 3,000 deaths from coronavirus. So I'm at a loss to understand why we don't think coronavirus is worse.
Because the spread is much wider.
That's right.
But that's what I meant by aggression. It is spreading far faster and more aggressively, isn't it?
It is spread. It's more infectious than SARS, without a doubt.
And more people are dying.
So it generates more cases, and when it generates more cases, of course, some of them will become ill and then some of them will die. But it is a lot less aggressive if you get an infection compared to SARS.
Right, so the individual case, it's less aggressive on an individual,
correct,
but it's spreading to far more people.
Correct.
So if it does become a proper global pandemic,
yes,
we could be looking at a lot of people dying.
Well, we reckon that the people who die, the percentage, is less than 2%.
Right, but 2% of the globe's population
it is a lot
of people.
It is a lot of people. And That is why we are trying to do, and this is the containment that we have to do, which is make the number of cases as low as possible, contain it, and contain it. And if you have fewer number of cases, then fewer number of people will become ill and fewer will go and die.
Boris Johnson is being very, everything's going to be fine, we've got it under control. Is the government doing enough from what you've been seeing?
The government can only do what it can do, but now it is also up to the community. And what my advice is that please don't get infected. One way not to get infected is to use good personal hygiene. I'll come on to that in a minute.
Or washing the hands.
Washing the hands.
20 seconds.
And washing
Should we
the
be
hands.
shaking hands? I mean, people have been... I've had doctors in here this morning shaking my hand. Should
I
they be?
won't shake anyone's hand now. I think this is a big cultural
But should we be or not?
Well, you could always do the namaste from India,
Yeah.
which is very, very spiritual.
I think people might take it weirdly if I start doing that in the street.
You never know. It will introduce quite a lot of peace and calm. My point is this. You keep your hands clean and you have to wash it frequently.
How often a day?
As often as you like.
So
but,
give me a number.
OK, I would say wash it every couple of hours, at least.
Really?
Right? Absolutely. Because the infection is from dirty surfaces or whatever to your nose, to your mouth. So you keep your hands clean. Wash it frequently. A lot of people don't know how to wash their hands.
OK, let's bring in Jonathan Ashworth. Jonathan Ashworth, thank you for joining us today. Is the government doing enough, do you think? Obviously, we don't want to start getting all party political about this and playing silly games, but is the government doing enough? I was surprised there was no Cobra meeting over the weekend with the President of the United States, Donald Trump, out there front and centre on Saturday, talking to the American people, giving a media conference. No sign of Boris Johnson doing that kind of thing.
Well, can I just quickly, before I answer that, just pay tribute to Richard for the extraordinary fortitude that he is showing. I cannot possibly imagine what he and his wife and his family are going through, not just now, but have gone through this whole dreadful episode, and that we will continue to press the government and the Foreign Office to do all that they can for him and his wife. I mean, it's just heartbreaking, and I just cannot possibly imagine what they are going through.
I think we all completely concur with you. Yeah.
On the broader issue, well, I mean, Boris Johnson is now attending a Cobra meeting. He hasn't actually attended any of the Cobra meetings so far on coronavirus, is my understanding. As it happens, we've been broadly supportive, however, of the government's approach in trying to contain the spread of the virus. I do have more wider concerns about whether the NHS has got the resources to cope, because we know, don't we? I mean, I'm often on your show complaining about the state of the NHS because of the situation it's in after sort of 10 years of cutbacks. It's had 17,000 beds cut. It's short of 40,000 nurses. So I'll be pressing the government today and tomorrow to tell us whether they're going to put more resources into the NHS to help it get through this period.
Yeah, what about, Jonathan Ashworth, bringing retired members of staff back in to the system in order to deal with this if it gets worse?
I mean, actually, funnily enough, I was calling for that on Friday, and then I saw it as a government announcement on Sunday. So I think that's sensible, although there are some behind-the-scenes bureaucratic things that have to be done about ensuring that those staff are on the relevant register, that their qualifications, if you like, are up to date. But also, staff working in the NHS need to be protected, because it looks like this virus is particularly problematic for older people.
So therefore, those retired staff you bring back in...
It might be the last people you want to bring back in.
Well, they'd be more at risk.
Because they might be more vulnerable to it.
Well, this is what we have to fully understand, but we have to make sure that staff are fully protected. I know, for example, a lot of GPs in the country, literally on the front, the very, very front line, are very worried about people presenting at your local doctors because of spreading it in the local doctors, but also staff getting it themselves. So I think we need more guidance from the top to NHS staff about how they can best protect themselves, because as you were just talking about, this virus is very, very infectious. Right. And that means NHS staff will start getting it, which will then in turn put more pressure on the NHS's ability to cope.